From drugabuse.com, marijuana dates back to 2737 BC. It was used in ancient Chinese medicine to treat some diseases such as rheumatism, gout, and malaria. It was introduced to the United States in 1545, but wasn't brought to Jamestown until 1611, and after reaching Jamestown, it was a cash crop. Weed's been around for a very long time and has a wide range of uses other than just getting high. Marijuana should be legalized in all 50 states so everyone has a chance to benefit from it. It is a very common misconception that marijuana is a gateway drug to other drugs, meaning once you try marijuana, you're going to try other drugs, but that is not the case. Many highly successful people have tried or used marijuana, such as former President Barack Obama, Governor Andrew Cuomo, and Bill Clinton. From drugpolicy.org, marijuana is the most widely used illicit substance in the world. Therefore, if the gateway theory were true, we would expect to see many more users of other illicit substances than we do. If the theory were true, every single person who has ever tried marijuana would have tried other drugs, but that is not true. Further supporting the debunking of the myth is from drugpolicy.org, saying, the gateway theory falls victim to the mistaken assumption that correlation alone implies causation. Using the same logic, one could argue that drinking milk is a gateway to illicit drug use, since most people who use illicit drugs also drink milk as young people. Now, we all know that's not true, so why do we openly assume that just because someone has tried one drug, they are going to try them all? It is widely believed that marijuana will lead to trying all kinds of other drugs and it can ruin your life, but with the evidence provided, it is neither a gateway drug nor is it something that will ruin your life. It has been proven that marijuana can help reduce pain in certain people. From health.harvard.edu, part of its lure is that it is clearly safer than opiates. It is impossible to overdose on and far less addictive, and it can take the place of an acid such as Advil or Aleve if people can't take them due to problems with their kidneys or ulcers or GERD. Marijuana is much safer than opiates for pain management as it cannot be overdosed on and is nowhere near as addictive as pain pills. It has also been seen to treat diseases such as epilepsy and eating disorders like anorexia. From Herbonot.com, multiple sclerosis patients receiving insufficient relief from traditional treatments in different studies have reported a dramatic decrease in spasticity when using marijuana. Especially smoking marijuana has strong evidence of decreasing spasticity and pain. As well, in a different study, an experimental laboratory study done in 1988 found that smoked marijuana significantly increased total daily caloric intake by a whopping 40%. Weed has been proven to help control pain in spastic episodes in epileptic patients, and it was used as a way to stimulate the appetite in people who had AIDS, cancer, or anorexia nervosa. It is proven that marijuana can be very beneficial in the medical field for controlling pain and stimulating appetites in a safer way than opiates and painful tubes. Anxiety, depression, and PTSD are extremely common in the United States, but all are treated with risky medicine and therapy, which sometimes doesn't work. Studies have shown that marijuana has been able to reduce or clear all symptoms for anxiety, depression, and PTSD. From Canacon.org, anxiety disorders are increasing at a high rate among people nowadays. The common reasons include a huge workload, relationship problems, and tight schedules. Cannabis has the ability to induce the release of endorphins. They make you feel better about yourself. With its regular use, you can drive the problem of depression away gradually. Thus, cannabis acts as a therapeutic medicine in the treatment and helps in clearing your mind to regain your mental health. The use of marijuana can help improve the mood and relax a person struggling with anxiety or depression. Also, from PsychCentral.com, it can take up to 6 to 8 weeks for an antidepressant to start taking full effect. But from herb.co, you can start to feel the full effects of marijuana within 30 minutes. Also from Canacon.org, the treatment of PTSD requires the increase of serotonin levels. This is where you can take the help of cannabis, as it is known to induce the creation of serotonin in the brain. It also helps in dealing with some of the symptoms associated with PTSD, including insomnia and recurring nightmares. Using marijuana to increase serotonin levels and improve the sleep schedule of someone who suffers from PTSD is a better alternative to several different prescriptions. Using just marijuana to help patients with anxiety, depression, or PTSD, as opposed to several different medicines, is a much safer alternative for the patients, and it works much faster than most antidepressants. All in all, weed is good. There are several different benefits of marijuana other than just getting high. Modern medicine is great, but as seen, weed has been proven to be better for some conditions over prescription pills. But what I ask you to do is look for local petitions that are for legalizing marijuana for medical use and recreational use in all 50 states so that everyone can have a chance. Marijuana may not be for you, but it may be the one thing that can improve the life of the people around you.